Welcome back to another episode of Sports Medicine on Tap. My name is Brandon Online. I'm sitting at Neck of the Woods Brewing Company with my good friend Dr. Frey, along with our good guest, Dr. Greenleaf. Hasn't been here in a while. Welcome back, Dr. Greenleaf.
Yeah, thanks for having me. Always a pleasure. Glad to be here.
Yeah.
It's good. And I mean, I did look it up. We haven't had you on since like episode 56, and we're proudly at 101 right now. So we made some distance.
Yeah.
100 would have been cool.
Right. Heard you were busy that day.
I was.
Yeah, exactly.
Well, thanks for having me. The show's awesome. So haven't lost any steam, so keep it up, guys.
Thanks,
Absolutely.
man.
We appreciate that. So we brought you on because we had a couple things that, in the time that we haven't had you on, we've had a bunch of different things that it's like, oh man, we got to get Greenleaf on.
We tried.
We tried. It's the epitome of this show, right? We try to get so many people moving pieces all the time. It's either we're not available or you're not available, and it just never worked out or whatever the case is. But so we stacked a couple things that are kind of things that are a little older. I mean, within the last couple months, nothing like catastrophically old, of like it's completely old news at this rate. But we had a bunch of different things to talk about. First thing, I just want to give a quick mention. We're all sipping on a nice, delicious sour at the table. You guys have the blueberry margarita. I'm drinking the blackberry crush.
Right.
And we are 11 days out from Sourfest on May 18th, Neck of the Woods. And by the time the show comes out, it'll only be about 8 days away. So we're creeping up here.
Heck yeah,
and
baby.
We're going to have Sourfest here at Total Turf at Neck of the Woods, Pittman, New Jersey. So please come out and check that out.
Yeah.
Tell me a little bit more about Sourfest.
Yeah, man.
Oh, man, it is one heck of a time.
Yeah.
They have over, 40 different types of drinks with sours, seltzers, and all different kinds of things. They'll have all the 20-some taps inside running. They have a bunch of tents outside with different stations.
Yeah. 12 to 8, May 18th.
12 to 8 p.m.
And Frank does it's amazing. Like he brews some really good beer.
Oh yeah.
But he seems, and again I'm biased to it. I like sour beers, but he just crushes it on the sour beer front.
Mm-hmm. Yeah.
So there's going to be a ton of sour beers.
Yeah. When I got here today, he was in the back hooking up all the kegs and filling them up for the Sourfest, and it's just like Frank in his prime. He's got goggles on. He's got big muck boots on, and he's all wet. He's got stuff all. He's cleaning kegs, going crazy. He goes, I got like 40 kegs over here ready to go. I got 20 more in the back, and he's stocked and ready to go. It's going to be a good time.
It's pretty cool.
Right from Breaking Bad.
Yeah, it almost is very much Heisenberg-like. Like he's just back there cooking it up. It's crazy.
And there was a fly back there too.
So we're just going to dive right into it. We had a couple things. One of my coworkers sent me a video of this softball injury, and we're at work right now. We're in the prime of softball playoffs, so I was like, oh man, hopefully this doesn't happen to us, God forbid. But there was a young woman named Hanna Delgado from Oregon softball during a game on April 12th. She's an outfielder. She went to go run for a fly ball and dove headfirst into the wall. And man, that's like one of the scariest things when you're on the sideline. Anyone diving headfirst into something and they go down hard, and they grab their neck, they don't move, or any of those motionless type things. It's like, oh crap! Like your heart just sinks, and you're like, oh, time to go.
Right.
And you just take off. So I watched a couple videos, I read a couple articles about her, and she was in an interview after. She goes, as soon as my head hit the wall, my whole neck felt like it cracked, and then I couldn't feel anything in my left arm. And I also wanted to give a quick shout out to the Oregon athletic trainer Kate Pinkerton and the Arizona athletic trainer Tracy Oshiro, who were both on site and acted very quickly. And that's a long run, as an athletic trainer, from dugout all the way to the outfield to the wall. You're going home runs distance to go save a life, in that regard. So that was a good hustle by them. They got out there really quick. Her teammates were also very supportive and told her just don't move, stay there.
Right.
And that's like a thing, at least from my end of the world. It's like, when athletes try to go, come on, pick them up real quick, it's like, just let them stay there.
Right.
Let them stay there.
Especially in that scenario. Like you see the way she goes into the wall.
And she almost immediately grabbed her neck, and she was kind of stuck. You could tell she was not in a lot of pain. It's don't touch her, don't move her, let her stay there.
If people haven't seen the video, and I'm sure most people have not, the best sort of description I could say would be picture like hockey when there's boarding, right?
Yeah.
Like somebody's 2 or 3 feet away from the board, and they get checked from behind, and they just go head first straight into the wall. That's kind of what it looked like, right?
Well, maybe even more energy. I mean, she was in a full sprint.
Yeah, full sprint.
It's not like she just tripped into it.
Right,
She
exactly.
literally dove head first.
Yeah, and it just sucks when you see something like that, because one, she was a senior, and this was her last year of college softball.
Yeah.
And I mean, at this rate, she's
That's a
you know,
drop in the bucket,
yeah.
given what you're risking there.
And, statistically, per the article I read, she was having one of her best seasons she's ever had. And so afterwards, she was seen in a couple different interviews and she was asked what happened. She fractured the C5 vertebrae in 2 places, dislocated the C6 vertebrae, had a hematoma, and then, according to what I read, she wore a halo device for a day or so, and then she had a fusion surgery the following morning. So I just write down all the basics of what the article goes, and I pass to you guys.
Oh, so many questions.
Right. You always wonder, as a surgeon, the first thing we wonder is, I wonder exactly what she had done, and what exactly was the pathology, the injury, how they fix it. Is it a plate, a screw, is it front, the back? And that's where we jump to. But understandably, you can't find that information out there. You can't Google, what did Delgado have done?
And we're not her treating physicians. We don't have access to her information or anybody else that we're going to talk about today. It's just we're using public information to kind of talk about these injuries.
Yeah, if I was gonna be investigate these, try to figure out what it was, the description of fractured C5 in 2 places and a dislocated C6, it makes you think there was a facet fracture, jump facets or fractured facets. Yeah, and facets are basically the spine is the vertebrae, the blocks of bone that stack on top of each other, and then in the back there's a little joint. There's 2 of them at each level, and that's what allows you to have motion. Like any other joint, the bones kind of rub on themselves, and they allow that motion. Those parts of the bone, they can fracture, and then that would allow the vertebrae to move the wrong direction, front and back. And the problem with that is the spinal cord's right there in the middle, and it can shift and pinch the spinal cord and the nerve roots, and to cause a lot of trouble. It sounded like in her situation, it didn't dislocate or displace enough to injure the spinal cord, just enough that it injured the nerve root, and that's why she had the weakness and the numbness.
Right. You see her on the field at in the video of her injury, and she's like lifting up her legs, and she's kind of laying there, and and clearly she's in pain, kind of grabbing at her neck, but you do see her like moving her legs. And all. In a scenario. Do you ever see a scenario where at the initial injury they have some movement like that, but then later on they lose it?
Personally, no. Can it happen? Absolutely. I think if it did happen, it's probably less so. So you imagine one situation where the injury went kind of unknown or undiagnosed, and you said, jump up and move around, and then suddenly a non-displaced fracture becomes fractured.
Right. Worst case.
It's probably less that the more swelling and a hematoma happen.
Got it.
So when you get these fractures, we have to remember bones are very, very vascular. They have a blood supply in them. So when they break, any bone in the body, when it breaks, what happens? You get a lot of swelling. So if the bones in the neck break and you get that swelling and you get a hematoma or bleeding around the spinal cord, you can go from being intact and feeling pretty normal, but then within minutes, at the most hours, if that grows and compresses the spinal cord, then you start to have deficits. And that's why it's such a timely issue to get right to the hospital and diagnose those early and get them right to surgery if they need that to be decompressed. And then you get into the whole controversy about steroids and inflammation and swelling, and we could talk for hours and hours about.
We talked about Kevin
steroids.
Everett the last time. Well, one of the times that you were on. Right?
And that whole concept of steroids, how the pendulum has swung so far that 20 years ago it was immoral and unethical not to give heavy doses of steroids right after any type of spinal cord injury. Now it's almost going the other direction, where we say, we think steroids cause more harm than good in a lot of cases. And now people are getting sued for giving steroids. And used to be the opposite when they didn't give steroids. Yeah. I think that, like anything else, that the real answer is somewhere in the middle. You have to pick and choose who to give it to and have the right expectations. I think this incident really highlights, too, how we're just never completely safe, right? Not to be like a Debbie Downer, but we think about spinal cord injuries and everything in football and head-on collision sports.
Right.
And it doesn't matter what the sport is. If you develop a lot of kinetic energy and you're running and there's something rigid in the way, you could hit it. It could be somebody else's knee and you might break your neck. So it highlights the point of always having safety personnel around, like somebody that could take care of these types of injuries.
Yeah.
We're gonna get into, I think, a tiny bit also and I don't know if there's a good answer out there, but what else can be done to try to prevent that? Just like you're saying, on the warning tracks there and this and that. But before we go down that road a little bit, so she had more than one surgery, right? She goes to the hospital. She has emergency surgery. They put on a halo. Why the halo? What's the purpose of having that initial surgery?
Yeah, well, I will say, one, timing-wise, do you think, did she have 2 surgeries?
I don't know. The honest answer is I do not know.
Yeah, my guess is they put her in a halo
and
to
did
stabilize things basically overnight.
Yeah.
And then they went through and did the definitive surgery the next day.
Understood. Yeah. So I'm considering the halo to be a surgery, but you're absolutely right.
Yeah. So the halos are, and you think of halo, you think like an angel and the ring around your head.
Right.
That's where that concept comes from, because the halos, it does in the end, it does look like a metal or a fancy plastic type of thing.
Right.
Yeah, that does kind of encircle your head like a halo would be floating over your head. But through that halo are little pins. Imagine almost like little ninja, something that a ninja would pull out and throw across the room, like not a sword or a javelin or anything, but small pins.
Right.
That you drill in, or like a pencil with a metal point at the end, that you drill into the scalp, you drill into the cranium of the bone, and it's connected to a very large vest. Picture maybe a football shoulder pads, like a big construct that goes over your shoulders, with bars that connect that halo down to the shoulder pads with the pins into your head. And it's a very nasty kind of sounding archaic thing. You don't see it very much. I'd say 20, 25 years ago was still sort of standard of care. And where you'd see it the most would be elderly patients where they fell and had fractures in the necks. We call them odontoid or C2 fractures. And it was almost standard of care to put these poor older patients in these halos to line up the fracture. And then you tell them they're going to be in those for a couple months, and you send them off to a nursing home, and catastrophic things happen. These constructs were horrible. They broke the skin down. Infections happened. You couldn't eat or drink in them. So they've really gone by the wayside. Honestly, I was kind of surprised to see that, because you don't see halos used very much. So they must have been really worried about the fracture being stable.
Right.
And that if they just put her in a little collar overnight, they're worried that it would move. So
wasn't adequate.
Yeah. So they put her in the halo to hold it still overnight, and I anticipate first thing the next morning they went and did the operation, probably gave her steroids overnight. Do what we call optimize medically, meaning getting the blood pressures where they need to be and the oxygens and things like that. So in many cases, you resist the urge to do something at midnight or 1 o'clock in the morning because you want to rush in and get it done quickly. In fact, a lot of bad things happen in the middle of the night. The surgeons, the staff, they aren't at their best and everything. In many cases, 7 or 8 o'clock the next morning is the safest time to do these things.
That makes sense.
A buddy of mine, med school, so 20 plus years ago, but a buddy of mine.
And I think he meant 40 plus years ago.
Yeah, like I said, probably.
We all say that
like
the 90s
which
were
is
just 10
still
years.
20 plus.
The
right?
90s were the last
plus
decade.
20, But I don't remember, 30 or 40, whatever it is, but a C2 fracture, and they treated him in the halo. Yeah, and he finished med school, and he whatever period of time, I don't remember, 6 weeks, whatever it was, like showing up in class, had the big thing on, everything.
Amazing, right?
Right. Yeah.
And then it makes you wonder if surgery was an option.
Right.
That's what you tell some patients. Say, we can do the surgery. Surgery obviously a little risky, but if the surgery goes well, and the little screws and rods we put in, they're in the right place and they hold well, then you're out of your collar in a week, 2 weeks at the most, and no halos. So it's that risk-benefit analysis is pretty attractive to avoid that halo.
Right, for sure.
Makes sense. Yeah, I would try to stay away from that. And I think, to touch on a little bit about what we were talking about, too, that dislocation of the C6, I think she even said in her little interview that she did after she came back. They honored her by letting her stand out in the outfield for her senior day, and they just let her walk off or whatever. And she was saying in an interview that, she was millimeters away of if her dislocation was any worse, it probably would have been pressing on, the spinal cord and having much more issues. And I think per the report, she's working on getting the range of motion back in her left arm. That was her kind of biggest deficit, obviously, without the on top of the actual injury. So we'll see what happens. I mean, luckily for her, it wasn't as catastrophic as it could have been.
Yeah.
Because you can,
I think for sure,
very, very much, go the opposite way and have no control or feeling going from the neck down or wherever the case is, and be much more, probably wouldn't even be a topic on the show because it had a poor ending.
Yeah.
You know what I mean?
Well, yeah, that's just tragedy. Another question off of her particular injury, and I don't know that there's a great answer for this, but I think in that particular scenario, you're tipped off by the fact that she goes, full speed ahead, head first into the wall, it's a kind of like your spear tackle, like pile driving right into the wall. Same
mechanism as spear tackling.
Mm-hmm. So immediately you have the suspicion, whoa, this is really bad, right? But her complaint, in addition to the neck pain, was that her left arm went numb. Right? It was numb. I couldn't feel my arm or whatever, whatnot. which is also a very common complaint when somebody sustains a stinger, which has the possibility of being bad, but in general is not nearly as bad of an injury. Is there anything you're doing or anything you're checking right off the bat to help distinguish between, it's a stinger versus something way, way, way more severe, such as this?
Sure. And this is where the safety personnel are trained well to do these evaluations. First off, and maybe the simplest way of saying it is, anything that's on one side is good news. I mean, obviously, any deficit or numbness or weakness is bad news.
Right.
But if just in one side, then you can assume
better news.
Better news, less bad news,
Yeah.
because then it means typically there's a nerve root involved. The nerve root, again, while not a good situation, is much better than the spinal cord. The spinal cord, which is right in the middle of the spinal canal, it controls both sides and really controls not only both sides, but both arm and legs. So if you have something, say, just affecting one arm, even if it's a stinger, I would say in her situation, most likely she was having what we call radiculopathy, and that's where one nerve root is affected. So if you get a herniated disc and it pinches one nerve and you have the pain shooting down the arm, or sciatica that we often think of, the pain and numbness that can run down the leg, that's typically one nerve root that's affected. So when she had this fracture dislocation, a bone chip or the shift probably pressed on or inflamed one nerve root. She had the numbness and weakness running down that arm. That's something that typically gets better. That's the good news. You get the pressure away from that nerve root, give it time to recover, and those things do get better.
And do bounce back.
Now, stingers, the nerve roots, like I was saying, they're pretty easy to figure out because we know based on our anatomy and physiology where each nerve root goes. So anybody that deals with spine and nerves a lot, in 3 seconds, if you say my numbness goes to this spot and this muscle's weak, we can say, oh, that's a C6 nerve root, C for cervical, and then there's number 1 at the top and 8 at the bottom, and we know where they go. And sometimes it can be a little confusing. They overlap a little bit.
Yeah.
A stinger, like you mentioned, Steve, that's more of a brachial plexus type of injury where multiple nerve roots can be involved and athletes who suffer stingers, which is basically a stretch of that brachial plexus, the nerves up kind of in your trap muscle a little bit outside your neck, that can often affect many nerves. So the entire arm could feel burning, and the entire arm, muscle, biceps, triceps, grip, they can all be weak and numb and burning. So that's a stinger type of thing. That's a little different than the pinched nerve radiculopathy. Again, both of those typically get better. The stingers usually get better many times within seconds to minutes.
Very quickly.
Those people might be back in playing the next series. A nerve root injury, they're not going to come back that game. And then, of course, spinal cord injury where both arms, both legs are affected. Then that's a more serious thing. Those people are going right to the hospital.
Yeah, no, I agree. And it's a good way to put it. So just a quick TV timeout, if you will. We're going to give a quick shout out to one of our sponsors, Virtual Orthopedics and Spine. From runner's knee and dog walker's hip to yard work back and laptop wrist, they've got a doc for that. Find the right specialist for you at virtua.org/ortho. Just to give a little love to our sponsors as well. And your guys'
talk about timing, right? Like you have the spine guy on.
We have the spine guy on. We're talking about Virtua Spine and Health, right?
Yeah.
But so I think, this was like kind of what you say, like a non-traditional spinal injury in that, like, you don't really suspect. I mean, it can happen, obviously, like we said. You get high momentum, you go into something that's rigid or hard, like a person, a wall, whatever the case is. You could have these injuries, but it's not common that you see a softball player go into headfirst into a wall. Right. You kind of suspect the spine stuff to kind of happen in the world of football, where in these or collision sports, if you will, lacrosse, football, anything like that, ice hockey, different things. So we have a couple other, football-related injuries we can kind of work through. One, I think I'm going to skip through the list a little bit here. I'm going to jump down to number 3 on our list. You and I talked about it before.
Happened a little while ago.
Yeah, a little while ago.
We were trying to get Bob on, and just timing didn't work out.
Timing didn't work out, right? Yeah. Donald Delahaye, a.k.a. Deestroying, the UFL kicker, also YouTube famous person. He was injured back in about a month ago or so in April. He went for a tackle, poor form. He took a hit. He felt stiffness in his neck, had a left arm numbness, and then based off of his, again, he is a YouTuber, so based off his 20-minute YouTube video about this, he had actual footage of him and the doctor talking, and they went over his diagnosis of a fracture to the lamina at C5, the anterior longitudinal ligament sprain, or the doc described it as a disruption, disc herniation at the C5, C6 level, and C6, C7. Doctor on the video said that he would be in a neck brace for about 3 months or so, and that he avoided surgery, and that he got pretty lucky because his form and tackling was very poor, and it's like that's the textbook of how you hurt your neck in football.
Right. Right.
And they probably don't get a whole lot of training on how to tackle correctly.
Correct.
Right?
Yeah.
You don't take the kickers to the side and say, "Here's your form tackle, tackle a dummy."
Yeah.
They probably tell them just to get on his outside shoulder and try to get him back in play.
Just try to trip him.
Do whatever you can
or
do.
get him to the sideline. Yeah.
And it was
Get in his
crazy
way.
is that the play did happen
his
like
way.
on the sideline. It was on the sideline. Like he probably, like hindsight 2020, he probably could have just pushed him out and it would have been fine. But I think in the video, I'll be honest, I didn't watch the whole. It's like 25-minute video going over this. I just skipped through. I saw a doctor and I was like, just give me some diagnosis information, and I got it and I left. But like I think there was some back and forth trash talking during the game of different things, and it was a little bit of emotional behind it. And
Sure.
take your wrong place, wrong time, and the next thing you know, you're in a neck brace and your football career is likely over.
Now, the irony on this is that the NFL is going to a new, safer format for kickoffs.
And they adopted it from the UFL where this injury
Which is
occurred.
where this injury, and it happens right after they adopt the new.
Yeah,
the new,
it was the timing of it was almost like crazily ironic. Is that like probably a week or two after the NFL announced it, this happened. It's like,
yeah. What are the rules? Like, how are they doing it?
So it's a little different now, right? Like there's no more of the full-on charge of people. They're going to be the kicker's still going to be the same around the 35-yard line, but everyone else is going to be on the receiving end. The 40 is where the kicking team will be, and then between the 35 and the 30 of the receiving field, the other team will be in the setup zone.
So they're like 5 yards.
Yeah, they're about 5 yards
10
away from each other
yeah.
now. And then once the ball's kicked, no one can move until it touches the ground or touches the player. Then action ensues.
Right.
And then
but they're
everything
not
happens.
charging into
Right,
each
it's
other.
only
for
a
those
5
big
yard-
So they have
hits.
5 yards to develop that.
Yeah, the
They get
momentum.
that speed to get going.
It's
Right.
not a 50-yard sprint, and then you get like an Eric LeGrand situation or something like that. You know
Right.
what I mean? Like,
right. We talked about him a little bit previously.
yeah. It's like, so they took it out to avoid that. But then, the last line of defense, if you will, is the kicker the farthest away and the runner.
Who may be charging.
Yeah, who might be getting that. But again, like we said before, it's like, you have to be smart with those individuals who aren't in the realm of tackling people every day. They're kickers, you know what I mean?
They're
not,
everyday people.
Yeah.
Like
they're not
normal
meant,
guys with a good leg.
Yeah.
Right?
And they're not meant to be tackling these big 250-pound people who can run a 4.2 40. You know what I mean? It's not meant math doesn't add up for that to be a good equation for anyone involved.
Yeah.
It's almost more reminiscent of a rugby match.
Yeah.
Where, they're 5 and most 10 yards apart, and they collide, obviously,
Right.
but they're not wearing helmets either, and that's a whole different
Changes
conversation.
everything.
But
Right.
yeah, you just don't have that energy build up.
Yeah.
Yeah. And so talking about his injuries specifically a little bit, we noted fracture laminoid C5, the AL, the anterior longitudinal ligament sprain or disruption, some disc herniations. Again, we don't have access to his medical charts. You're not actually looking at the studies, the MRIs, and have an idea of really what you're looking at. But when you hear that stuff, when you hear that description right off the bat, is your first thought non-op, or is your first thought usually more of a surgical intervention?
You would guess surgical, but and this might sound counterintuitive, but when you mention the lamina, again, it's kind of fancy anatomy of the spine, but the lamina is bone. It's kind of the back, the roof of the spine. So if you push on the back of your neck from on the back and the middle of your neck, you're pushing on what we call the spinous process, which quickly becomes the lamina, or kind of the roof. I'm sure there's a Latin name. Lamina probably means like roof or ceiling or something like that.
Probably, right?
More than likely, right?
Yeah. So, but that's bone. So that's
Right.
bone. So bones, there's a few things that bones do, give us structure, but one thing they do is heal. They form new bone. So whatever the bone is in the body, if you crack it and the bones are close to each other, they're going to form new bone and they're going to regrow and they're going to heal. So same thing with the neck. So if you have an injury that predominantly is a bone injury, a bone fracture, and not a soft tissue injury like a ligament or a tendon or the disc, the bone injuries will heal.
Right.
So if you rupture, if you tear through a disc or a ligament, those things don't heal. They don't have a good blood supply. They don't have much biology. They just become more and more unstable and they cause trouble, and those need operations.
Right.
So it sounds to me like his injury is probably more of a bone injury. And they said, look, your spine's lined up pretty well. The bones are next to each other. Give it a little bit of time. And just like if you break your wrist or your rib or your toe, this is going to heal back together.
Let the body do its thing.
Yeah. So stick them in a collar and then go. Now, I was going to say maybe there are scenarios where you'd want to be back quicker, but even with an operation, you're not going to be back to collision sports and high speed things, in less than 3 months. So,
Right.
So I think that's the best case scenario. Now they might give him 3 months. If he was, the big question, I guess the question of all these things are return to play. So I would anticipate if he would heal, they do a CAT scan, which is the best way of imaging, a fancy imaging study that looks at the bone.
Right.
And they see that the bone all lined up well, and they take him through a range of motion, and it's not painful, and he's neurologically intact.
Yeah.
I would guess somebody like that would probably play again.
Give him another go.
Yeah, I would think so. Bones heal.
I think they're talking about like that's it.
Yeah, I think based off the video that I saw and kind of his posts and the different things he's done on social media, I think he's going to hang it up from this. Like, I think it's smarter for him because his story was interesting. We dove into it before of like he took some time off from college and it was just all up in the YouTube business. Yeah. And then he started to make a video series of him trying to get the professional.
But he had a YouTube presence, right? He was being very successful. Yeah.
And it's ironic is that he had to leave college football because he was making money off YouTube back in the day before the NIL deals, and now these kids
couldn't make money then.
You couldn't make. You weren't allowed to make money from
right.
as a college athlete, but now it's a whole different ball game. If he was, into the weeds, like into college sports now, which brings us kind of into college sports. The next topic, we just got over the NFL draft about a couple weeks ago.
Yeah.
And I was watching it. Big Eagles guy, so I'm waiting around for like the 20th some pick from the Eagles are going. Yeah. And it's about pick 15 with the Indianapolis Colts, and they pick a edge rusher. I'm going to butcher his name, and Laiatu Latu is what I've heard. They drafted him, and I was like, okay, cool. They drafted an edge rusher, and then the reporter who's interviewing him was like, hey, it's kind of crazy your stories. You went from medically retired, and now you're in the NFL. And I just was like, wait, did I hear that correctly? I rewinded my TV. I had to rewatch, and I was like, she just said he was medically retired for something. So then I started digging. I started looking up some different things. I think I texted you right away. So I think the Indianapolis Colts just took a really interesting person. He said he was medically retired. So a little bit of backstory here. A couple years ago, back in April of 2021, Laiatu Latu was playing for Washington. And in April of that year, his coach announced that he would be getting neck surgery and that he's medically retiring from football from the injury that occurred in the preseason 2022, which is interesting because it was in the mix of like the prime of COVID. So there was I'm sure there's some restrictions and they were just doing something preseason related. He got injured, and then in a recent report, he stated that he had spinal fusion surgery then. And Washington said, "You're done. You're medically retired. We're not clearing you to play collision sport or football here anymore. We'll take care of you. You do what you're going to do."
Right.
And it was kind of everyone thought that he was going to become a student assistant coach and work his way up and do the coaching route of what I've seen plenty of times for folks who've been medically retired for heart issues, other things like that just stick around the program because it's hard.
Yeah.
Psychologically to go from playing to saying you're done and see you later.
Right.
Where they try to keep the kids around.
Keep you involved.
Have a role.
Yeah.
Right. But according to the articles he read, he just wasn't satisfied with that answer, and he's like, I think I can make it back. So fast forward about a year, or the end of that year rather, the end of the year 2021, he announced that he was returning to football and transferring to UCLA. And after his injury, he went and saw Dr. Robert Watkins, who was a well-known spine surgeon who treated Peyton Manning previously. He gave Latu the thumbs up to return to football. But the Washington staff said, nope, you can't do it here. They kind of stuck to their guns. They said, you're not cleared to play football at Washington College or university, rather. And so he transferred to UCLA, and I believe the position coach went there as well. So he had kind of like a little bit in. Chip Kelly agreed to it, took him in. Their staff went through a battery of tests in the 2022 offseason. May and June, they said that he saw a bunch of specialists, got the thumbs up to go. And so then he's back on the football field. 2022 season, played for UCLA 2022 and 2023, and then got drafted 25th or 15th overall in this year's draft.
Yeah.
And wow.
Amazing. 15.
15.
Wow.
Right.
And you go from medically retired to the top 15 pick in the NFL draft. What a ride.
Right. And I know like a lot of the conversation, right? It's sports medicine and spine injury, so a lot of conversation ends up revolving around kind of return to play and that part of the equation. But in this scenario, do you find it a little bit surprising that we don't know the devil's in the details? We don't know the details of his particular injury and surgery, leading up to the medical retirement. But is it a little bit surprising that he would be declared retired from football because of a spinal fusion?
And I can't emphasize enough what you said, Steve. It just depends so much on what was done, and it's just such a good example how so much of this decision making, the return to play it's like anecdotal, it's gut,
right?
Because it's not as if we have studies done. We like to base everything on
Well said.
randomized prospective studies where we
Right.
took 1,000 football players and did this certain surgery on them, and 500 of them we let do this, and we see what happens, and here's the answer.
Went really badly for this 500, so now we're going to stop.
Yeah, exactly.
Yeah,
right.
right.
These guys all reparalyze themselves. Okay, so we won't do that.
Better,
Yeah.
yeah.
Let's try another thing.
Right.
Right. So it's more just on kind of intuition and how bad the injury is, and how confident you are with the fixation that you have, and even the art of medicine, like knowing that kid and their family, and are they going to follow instructions?
Very
Are,
true.
are they a good?
Yep.
Do they tackle properly? Do they have the right expectations and goals? And so it's just it's so hard. And I struggle every day after spine surgeries, any type of surgery, and patients asking, hey, can I go back to the gym? Can I get on my bike? Can I start jogging again?
Right.
Even in those situations, I mean, I panic a little bit and say, oh man, you know what? There are some people that go back and start running marathons and never have a problem. And then
Right.
there's the next person that jogs a quarter of a mile and their back flares up or their neck flares up and they have issues. So how do you figure that out? I mean,
Right.
That's kind of the, I lose sleep over that all the time.
For sure.
The right expectations and goals coming back. And, and I panic with telling a 70-year-old if they can go back and do yoga or not. So imagine telling these high-level athletes the right or wrong answer, because it's
Massive collisions.
and it's all luck too. I mean, if you go the route, you could play 10 more years and avoid any serious head-on, impact injuries and do perfectly fine, and then you just have that one freak little accident. And you
Pardon,
You get a
Philly
bad-
just hit a grand slam, and everyone in the brewery's going a little wild right now.
Grand slam. Wow. Oh my goodness. So so it's so much luck too. It's that energy just in the wrong direction that could blow everything apart.
Yeah.
So it's a betting game, right? So if I say, look, you can tell a patient, look, there's probably a 95% chance nothing catastrophic could ever happen if you come back and play.
Right.
And then you say, are you willing to take that 5% chance? And
Yeah.
you put a little bit back on the patient there too.
Sure.
So it's a great illustration of how there's never an exact right answer.
Right.
Yeah. The Watkins, that probably played a lot into it. So Robert Watkins, it's a father and son duo out in L.A. I'm assuming the father's probably maybe retired, because I think he's been around for a long, long time. But he was kind of like the spine surgeon to the stars, like Elatrash, right?
Yeah,
Like
Neil
the sports
Elatrash.
guy,
Yeah, of course.
and then the guy from Alabama.
Andrews.
Andrews.
Yeah, James
So he
Andrews.
was he was kind of that. So if you were out west and either you're a famous person or a big athlete, you went
Right.
to Robert Watkins. So,
Sure.
so getting the blessing from him was probably a big deal.
It
But
carries a lot
Right.
of weight. Right.
carries a lot of weight, and somebody like Chip Kelly and the trainers at UCLA, they don't want to be on the hook either.
Right.
They're going to look like real jerks if they let them play and then something catastrophic
Yeah.
happens.
Of course. Right.
So tough decision for everybody, and it's it's a mutual decision between the providers and the patient and their family.
Yeah, and I think you kind of see both sides of the spectrum, right? Of like, you see someone who takes a more conservative approach and they CYA, if you will, and Washington said, no, we're done. You're not allowed, not
Yeah.
here. You won't do it here.
Right.
You know what I mean? Like, they don't want any part of, like you said, they don't want to take that risk of that
Yeah.
5% chance of something happening. They're
Yeah.
like, nope, not us.
Sure. Well, look at the downside of this kid gets hurt really bad.
Yeah.
First off, that kid's hurt, and what's going to happen to his and his family, and the
Right.
bad press, and the lawsuits, and everything that are going to come from it.
Then that closes a football program as a whole. Like, that could just shut down a complete
big
program
deal.
and it goes away.
Right.
And
but
then with the decision to keep going for this kid too, I mean, what you have to think of, and he's not a kid, obviously, he's probably in his 20s, but doing that whole risk-benefit analysis, do I come back to play? I mean, there's the whole, I've been playing football my whole life. I love football. What will I do without it? Well, guess
Right.
what? No matter who you are, your football career is going to end.
at some
Right.
point,
Never
right?
been anybody that hasn't ended. And 99% of players end, you don't ride off in the sunset rich and famous. It ends because you build up injuries, you can't do it anymore, and you just kind of disappear and nobody even knows except for like your family, right?
Right.
So he was, when he was doing his risk benefit analysis, he said, look, I'm good enough. I could get drafted in the first round, and there's
I might make it. Right.
many, many millions of dollars.
Yeah.
So
Yeah, I
that,
mean,
that
that's
makes it tough.
Life-changing money to take that risk. It's like people play the lottery every day, and they have much less chance of this. Like,
Yeah.
Yep.
Yeah.
If you're the third
Less
string,
on the line, but yeah.
Yeah.
third string defensive end for Wichita Junior College,
Right.
you're not going to come back and play because
Right.
it's not worth it. But this
Right.
guy's a different
The
situation.
ceiling is lower, right?
And I
Like, what
think-
do you have to stand to gain to take
Yeah.
all that risk? But in this scenario, the ceiling's way higher, right?
Yeah.
Like so maybe you're willing to take a little more risk there because you know the reward can be huge on the other side.
Mm-hmm.
Yeah.
Right, and I think it's just like you said, the risk and reward for him. And I think going into it too, prior to his injury and stuff, he was a highly recognized player. Like everyone knew he was really good, and it's like it's just different. Like when I read the article, it's like okay, you saw a doctor who saw Peyton Manning, right?
Right.
But position-wise, completely different ball game. You're the guy tackling the quarterback, and the quarterback conversation here. Like Peyton Manning isn't doing as much contact as he was, and as he will be doing in his world as a defensive edge rusher. But see what happens. I mean, and it's ironic too. And I think Dr. Frey talked about this before. Is that Peyton Manning was traded or let go from the Indianapolis Colts when he had this neck surgery, who was operated on or treated by Dr. Watkins, and then they draft a kid who was cleared by Dr. Watkins for a neck surgery, and now he's playing on their defense now. Obviously, much changes in the coaching and GM and stuff and different.
Well, Peyton left there and won a Super Bowl, so maybe they learned their lesson.
Yeah, they learned the lesson.
But at the same time, right? Like at first, watching Peyton play, like
after his neck problems.
early on,
Yeah,
it was
right.
rough.
He couldn't throw a ball
Yeah.
20 yards.
But like you said, it all came back. Then they win a Super Bowl, and
Then he rides off in the sunset.
He rides off in the
It's
sunset.
like,
yeah.
But that doesn't
He's-
happen to everybody.
No, he's unique. He's unique.
Another quick word about our sponsor, Virtual Orthopedics and Spine. Runner's knee, dog walker's hip, got a doc for that.
Mm-hmm.
Yard work, back pain, laptop wrist, what have you. Knee injury, got a doc for that, right? So Virtual Orthopedics and Spine has over 120 providers, over 20 physical therapists and rehab facilities, more than 25 surgical centers across South Jersey. Find the right specialist for you at virtual.org/ortho. Basic premise here is if you got pain, you got a problem, you have an injury, they're going to have a specialist for you.
Well said.
Thanks, man.
Absolutely. And I think the last one on our docket here is kind of what we tied into of you can be a high drafted person. You can be but they're historically called bust, and they just kind of wash off and no one knows who they are.
Right.
And then there's a case of just because we had Dr. Greenleaf coming on, I was like, I'm going to just check, see if there's anything else about the next
Let's take advantage of it while we can.
Yeah, exactly. we got to utilize it.
That guy works a lot.
Yeah. Got to, be useful of his time and our time. So I was like, anything neck related that's going on? And I saw an article about Chase Young, another edge rusher, who was a number 2 overall pick back in 2020 for the Washington Commanders. But now he just signed a deal with the New Orleans Saints.
He was Ohio State, right?
Yeah, Ohio State guy, yeah. So he signed a 1-year, $13 million deal. $8 million of that is all play-based incentives based on his time played and different statistical incentives. But he's had a neck procedure about 2 months ago or so because he has a long history of neck stingers, I believe, per the article I read on ESPN. And I just thought it was interesting, and they kind of went down his free agency route of, I think it was last season he got traded from the Commanders to the 49ers, had a half a season with the 49ers, and they kind of like, all right, we're good. We saw what we saw, and I guess whatever the case is, the business of professional sports, they let him go test it out. And I think he had
I didn't realize he didn't finish the season with them. That actually, I didn't realize that.
Yeah. They didn't want to re-sign him, or they didn't re-sign him, and he had a history of ACL tears and a couple injuries when he was in Washington. He was very highly rated going out of college.
Oh man,
he was like the best thing ever. And I have a friend, and Dr. Brant probably was super excited about him as a Commanders fan. And now we're here, and he's making his way. But I thought it was interesting that he had a neck procedure done. They said on the March 21st. He said he'll miss most of training camp, but he should be ready for the start of the season. And I think this neck injury or procedure that he had on his schedule was a big factor in going into all these negotiations for his contract and stuff. Mm-hmm. So I just thought it was interesting of
risk.
Yeah, what the risk was and kind of how we break that down. Again, we just hypothesize of what it could be.
Yeah. Do you know what procedure with like Lammy or like what would you do for that particular? If someone's having recurrent stingers and you're doing a procedure to try to treat that.
Sure. Yeah. That is the curious part of that. You see procedure. If he had a fusion, we usually see fusions, and that's like the F word. They'll say that.
The F word.
The F word.
So, but it's provocative to think about that. You have these recurrent stingers, and there's a lot of reasons they can happen. Anatomically,
Yeah.
But one of the things that could be happening is he could have some narrowing where the nerve exits out of the spine, and we call it stenosis. That's a fancy term for narrowing of like a little tube in the body. So if those nerves are in a tight spot and they're being trapped and pinched as they come out of the neck, and then every time he stretches his neck one way or tackles somebody or gets the arm pulled, and it pulls a little bit of tension, even just a millimeter of tension on those nerves, and they flare up and it causes that problem. The theory at least could be if you go in and you could do a relatively minimally invasive surgery, like through little tubes or endoscopically, and just free up those nerves, just make a couple millimeters of space, and now those nerves have a lot more room to move, and maybe you won't get the stingers.
Yeah.
So that's what I would anticipate he had done. And those are easy things you can find on an MRI scan. You say, oh, look at these 2 or 3 nerve roots are being pinched.
Yeah.
Go and do a little clean out. So the whole time we've been talking about fusions with with bone grafting and fusing bones together and hardware. That makes your spine, which is something that should be moving, makes it rigid. So those things can fail if they don't heal well. They can break and fall apart. Or if they do heal well, they can put more stress on the mobile parts, the discs above and below. So there's a lot of problems that come with hardware infusions. This is something that you don't do any hardware fusions. You just do a little clean out, you make nature look a little bit better, and you let it heal, which is, a few weeks of soft tissue.
So it's just a matter of healing from the surgery, making a cut in the skin.
Makes it no different than like a meniscus cleanup.
No, that's intense.
Yeah.
That's intense.
Right, a monkey could do that, right?
Yeah. No, I think it's interesting because, like, you see these big names, and like we said, like, you could just vanish.
Right.
It's kind of, and granted, I think he's had a decent career so far. It's only been a couple years, but I think, the being on a not-so-good team with the Washington Commanders, they didn't make a big splash with him, adding him to, then he tore his ACL, then he kind of went away.
It was right away, too, right?
Yeah,
Right at the beginning.
yeah.
It was like, all right, we'll have to wait to see how good he's going to be.
And he came back, okay. And I think it took a little longer for him to come back, too.
Yeah.
I just think that too, with such a big explosive athlete like that going against 300-pound guys, like you're trying to stop him, it's a little harder just to come back and get all that power and everything,
you lose one step. I mean, that's the name of the game in all sports, right?
Right.
You just get a little slower.
The margin of error is so small.
Right?
There's some 22-year-old that's a little faster than you coming through
with healthy knees and necks, and then next thing you know, they're going to get that
you're
spot.
Going. Yeah, rough business, that's for sure.
Very interesting. So what else we got?
Adam Talaferro Foundation. I'm sad. I apologize that we haven't talked about it a little bit sooner. And we've had Bob on a few different times in the past, and it always seems to be right around this particular time of year.
Ironically,
and it's a pretty awesome thing that you're involved in. Can you tell us a little bit about Adam Talaferro and the foundation and some of the stuff that's coming up again, please?
Yeah, sure. Thanks, Steve. Always happy to plug the foundation. So at Adam, and if we ever want to sit and talk about cool spinal cord. We're beating a dead horse a little bit now, but Adam's a prime example of a spinal cord injury. Adam was a local hero. Went to Eastern High School here in Voorhees, and he was. I mean, it's biased listening to people talking about him because they're all Adam supporters. But there are a lot of people that argue he was one of the best athletes in Jersey at the time. He was a great basketball player. He's a great defensive back and running back, and he went to Penn State, and he was good enough there to almost walk in and start, and they didn't even know should he be a running back or a defensive back. So defensive back his freshman year, playing against Ohio State, like we mentioned. Hits a tackling somebody, head was down a little bit, and he suffered a C6 injury. Oh. Now, fortunately, his was an incomplete injury, meaning he had a spinal cord injury, but not anything that resulted in permanent paralysis. He got most of his function back. He rehabbed really intensely down over at McGee Rehab, which are our close partners, and he went on to have a phenomenal. He finished college. He went on and got his law degree. Got into politics, so he's doing fantastic. Right. So he's a model of recovery and of courage. So the foundation is meant to help out patients, well, they become patients, but human beings who suffer spinal cord injuries, and we delve into some other type of injuries as well. But spinal cord injuries and basically help them with support.
What way does the foundation support them or help them?
Yeah, so when patients like this come through their hospital, the whole marathon. So it's a hospital, it's surgeries, and the hospital, you go to a rehab somewhere like McGee, you're there for many, many weeks, even months, and you coming out of there with hundreds of thousands of dollars in bills. Your life's turned upside down. Your family's life's turned upside down. and you get home and it's not as a you're in a wheelchair, you have these deficits. Everything in your life has to change. Like you can't just go back. It's not like you go home from rehab and say, okay, let me crawl in the bed and
back to life.
You go back to life. Right. Life's all different. So you can't get into the house. You need a ramp. You need wheelchairs. You need electric wheelchairs and manual wheelchairs. You need additions put onto your house. You need railings put in there.
And that's on everything. You. That's not an insurance covered thing.
Insurance covers very little of that when you come home.
Right.
Yeah, very little of that. So that's what we do. We provide support for patients and families who need that, and raise money for those through various endeavors. One is the flag football game, which we'll mention briefly, but that's basically what we do. When we get in the end and they have all these things confronting them, we try to help patients and families take care of some of those bills so their lives are a little less disrupted.
And I think you even mentioned it earlier, just like these things happen, and you didn't want to be a Debbie Downer when you said it, but like it just a snap of a second.
That's it.
Everything changes.
Moment.
Even go back to Hanna Delgado. She said it in her thing. She goes, it's crazy to think about. Like I used to really get mad about bad at bats where I like hit a ball really far, but she still caught it and I get mad. But now that kind of stuff doesn't matter anymore because it's like
so insignificant.
So insignificant. It's all in perspective because now your life's completely upside down and you got to worry about. You don't have a rail in your bathtub because you can't hold yourself up or you can't use for assistance. Different things like that. It's like way more.
But not just you, not just person injury.
Right.
Your whole family.
Right.
People have to quit their jobs, and they, the entire
the orbit, everybody
down.
Around you.
Yeah, absolutely.
I think it's anytime someone's faced with tragedy or with obstacles like that, catastrophe on kind of on that magnitude, I think everybody goes down that same road of like, why did I care about the person that cut me off on my way to work? Kind of, like why did it and why didn't I enjoy that moment? With my family or with my kids. Like while I could do it or enjoy the run I went like it just puts everything else in perspective. And I find it interesting. We talked about this. Anybody, and I don't plug a lot of other shows. I don't remember which show it was. Maybe 6 episodes. One of the episodes that you had come on in the past, and we talked about Jack Eichel. And we talked about some of the some other spinal cord injuries and whatnot. Like go back and listen to that, man. Like his one is a lot of detail and it's a really nice episode to hear. But then 2, like we went through some of the a lot of the guys who have had these injuries, Ryan Shazier, Dennis Bird, like they all seem to go down the same route. Like everyone's broken down to the same level. Everyone's on the same field, same playing field, so to speak. And they realize like they have advantages because they're in a different place in life, right? But they all start foundations. They all try to help because they see.
They know what it's like.
Yeah. Like these are the basic important things. People are losing their activities of daily living. They're losing the basic functions, and they need help. And so like a foundation like this. I don't know how you guys do it, man. The Greenleaf's like, yeah.
Well, I think, Steve, I think your point is exactly right, but I think in some ways it's a little wrong, though, because you hear about these guys that start the foundations and get in front of cameras and do great, but those are the ones that they have a combination of the resources to allow them to do it. They have a lot of money and people around to help, and they start foundations and they look like wonderful people. I mean, that's probably like the 1 or 2% of spinal cord injury people that are able to do that.
Right.
The vast majority of spinal cord injury patients are the people working a couple jobs, not doing very well.
Right.
They run their car off. Who knows, for whatever reason, they have spinal cord injury. They don't have resources and money and all that stuff behind them. And they might go the other direction. I mean, it's spinal cord injury like this, it's a fork in the road.
Right.
They might go the direction of depression, drugs, alcohol. They don't have support.
They're all on lines.
And they perish and they do terribly because they don't have support.
So, and I probably wasn't very clear about it. The point I was trying to make is the guys that do have that, the ability, right, that those advantages at that particular point in time, and they see it all happen. They see it happen to them. They see it happen to other people. At that point, say like, they realize, holy crud, like there's more to life, and I need to help.
There's a bit of
despair. And they want to give back.
They want to give back, and they help the other people who don't have the opportunities and don't have those advantages and their ability to cope.
Mm-hmm.
Yeah.
Yep, absolutely.
Yeah, I wish we talked about it a little bit sooner. Sorry about that. We should have gotten
No,
should have plugged that early.
We're not
what are the events that we have coming up for the foundation?
We in late June we have one of the big events we do every year is a flag football tournament. It's going to be actually right here.
Total Turf.
At
Total
Total
Turf.
Turf here,
Yeah.
right across down the hall.
Yeah.
For both high school age and youth. We have a youth division this year, so that's in late June. Everything's always on our website, adamtalaferrofoundation.org. And again, it's great. It's a great story. It's the foundation. There's no kind of rhyme or reason to who's on the board and who helps. It's word of mouth almost, like people that are involved with it, and they've got buddies that say, or friends or colleagues. It's just, nobody makes money. There's no positions or anything. We meet once a month virtually and say, what can we do to help? And basically, when you have connections, you say, let's use this, or I'll talk to this athletic director or this coach, and we'll get these teams involved.
Yeah.
So
Good people.
It's good people. Yeah, it's help a lot of people out. So it's nice at the end of the day.
Absolutely. Well, we appreciate that. I mean, you being a part of it's huge. I've had some colleagues who are involved with it, and I think it's been a positive limelight of the foundation all through and through. Never heard bad things about it. It's always had a positive impact on the community and different things. You guys also do CEU events for athletic trainers and other sports medicine professionals, physical therapists, other things like that.
Yeah, next Wednesday. Yep.
Yeah, and there's one's coming out. It's going to be
Talk about timing.
Talk about
Right.
timing. So if you're hearing this live when we post a show, it'll be on the 10th. Their next symposium is on the 15th from 8 a.m. to 11 a.m. So again, go to their website and check it out. And you can find all the information on there. If you
Get
wanna
on board.
Get on board with that as well.
One of my buddies from college, I'll give him a plug. I can listen to Clint Wattenberg. He's an All-American wrestler at Cornell and went on to do great things. And he was the kinesiology nutritionist for UFC out in Vegas for several years.
Oh,
And
wow.
now is the assistant AD at Virginia Tech. Head of nutrition down there. So he's going to be on there talking too.
Oh, wow.
So talking about
Yeah.
nutrition, and which is a big topic, right? All these sports drinks and refueling and things like that.
So much
Some,
stuff now.
a little bit of scary stuff out there, and I mean that's a topic for another show. But yeah, oh man, so much stuff.
Well, I mean, that's, not to keep dragging it out, but I mean, that's what we talked about the last time you were here. We talked about Fernando Tatis and like the supplements and all these different things. All like a very similar discussion of like, there's so much stuff out there and these athletes just don't know,
Right.
or they do and they don't know, or whatever the case is. It's just, but you need people like, your friend that you mentioned that like have the good information. They present it to people so you have a good foundation of like what you can tell your athletes and your patients. Like, you probably shouldn't be drinking whatever this crazy YouTube drink that you find, or the whatever you saw your TikTok your friend doing. It's like, maybe you shouldn't do that. You'd be a little safer.
Sure.
So again, Dr. Greenleaf, thanks for coming out. It was a good time talking to you again. I mean, it's been a little bit. Hopefully we get you back on sooner than later. So we're going to go ahead and close out our tabs here, folks. And we want to give a quick shout out to our sponsors, Virtua Orthopedics and Spine. They have a doctor for everything you need. They have over 120 different providers, over 20 PT and rehab facilities, and more than 25 surgical centers all across South Jersey. We have Neck of the Woods Brewing Company serving us up the best beers in the local area.
Sourfest.
And Sourfest, May 18th, coming in hot. And lastly, Timbera Productions, to our guy Kyle, who's always helping us put all this stuff together. The audio, the video, the social media videos, everything else. We appreciate you. And we'll see you everybody next time. Thank you.